Good afternoon. I like it. I bring you greetings from the Division of Public Health in the Department of Family and Preventive Medicine. If I see you on your phones, I'm assuming it's because you're either taking notes or you're tweeting some of the things I'm talking about today. 3-10-83, the oldest of three, Sanford, NC, home. A place you grow up wanting to leave and grow old wanting to get back to. Born and raised in the sticks, in the country part of North Carolina, where it's very common to see chicken houses. Deers will hit you year round, and it's pitch black at night. Growing up in the country, I've always been really big on family. So you can see a photo here with some of my family members at a family reunion. So family reunions, they're usually great events where you have young, old, doing numerous things that increase your risk for cancer, smoking, eating processed foods such as hot dogs, et cetera, but having a great time. But in general, growing up in North Carolina, my family's always been big on education. So I started out with a bachelor's in applied mathematics with a minor in accounting from North Carolina State University. From there, I went on to get a master's in applied statistics from Kennesaw State University in Kennesaw, Georgia. There is where I was a research assistant for a national program called the African American Male Initiative, focused on recruiting and retaining African American males for undergrad. During that time was a very pivotal point as I had a mentor by the name of Dr. Lawson here, who really felt that it would be a travesty for me to be sitting behind a computer for the rest of my life, since I was always really good with people. So went back, prayed on it, and considered going into public health. It was one of the best decisions I ever made. Ended up getting a PhD in health education and behavior from Texas A&M. Whoop, gig 'em for those in the room. Did a PhD in 3 years. And then from there, because I like to learn, I went on to the University of Minnesota, where I did a postdoc focused on cancer-related health disparities and community-based participatory research, as well as a master's of public health focused on public health administration and policy. You want to know more about why I got those degrees, we can talk during the break. The one key person that did a lot for me at that time was Dr. Kola Okieme. And so Kola was my primary mentor. You can see him here probably eating up one of my papers or a grant application. And so, shortly after that, he was recruited here to Utah. And so I had never really heard about Utah. And so I knew if they got him, then maybe this is a really good place to come. So I got here 6 months ago. And it's been one of the best times of my life. In only 6 months, my work has been picked up by NPR for a study I did in California, Alabama, Minnesota, looking at attitudes in terms of genetic and genomic testing for prostate cancer among African American men. Recently, I was featured in the national biannual magazine from Fight CRC, a national colorectal cancer advocacy organization, and I also became a member of Huntsman Cancer Institute. So all this has been fantastic, but there has definitely been some key things that have happened in my life that have made all this possible. So again, growing up in North Carolina, I was unfortunately around health disparities all my life. So growing up in NC, I always heard about African American men getting prostate cancer and African American women getting breast cancer. In this photo here, right before that, in that summer of 2009, we were having our annual family reunion. Again, doing things to increase your risk for cancer, but also decreasing risk, such as like exercising by dancing, et cetera, drinking water for those who did that. And my aunt here, we noticed that she had lost a lot of weight. And so we just figured, maybe she was eating better. So in the fall of that same summer, 2009, we noticed that my aunt had stage 4 CRC. I'll say CRC from now on in terms of colon cancer. So in case you're unaware, colon cancer is preventable if you get screened. Catching it early, stage 0-1, you have a 90+% chance of survival, but stage 4, like my aunt, you have a less than 10% chance of survival. And so you'll see here, I have a note in the corner that my aunt at that time was 52, and if you're aware that the recommended screening age for a while has been 50, so we can just imagine how she may have been in a different place today if she had got screened earlier. And if you even look at the literature even more, and I'll go into that some, we know that it's a big thing now as of this summer from ACS that screening actually be starting at age 45, because it's been such a big thing. So I always like to give a shout out to my aunt in any talk I do for helping me find my purpose and continuing to push me in everything that I do. So shortly after that, during the first summer of my PhD program at A&M, I was one of 8 nationally for a health disparities program, working with Chief Colorectal Surgeon Arden Morris, and she was trying to figure out where African Americans would get surgery, but they wouldn't get chemo. And so from this program, which was called like a health disparities immersion program, we used to joke and say it was almost like being baptized in health disparities because you would learn so much. And so from there, I really saw that there were quite a number of gaps in the literature as it relates to African American men. So if we transform in terms of actually speeding up to what the literature looks like now, for me as a black male, I have a 27% higher chance of getting colon cancer than a white male and a 52% higher chance of dying from it. So as I went along in my career, think about how I could actually fill these gaps, a lot of things happened. Initially, during my first summer of my postdoc, I had an opportunity in partnership with the ILI, the International Leadership Institute, to do work in Eldoret, Kenya. And so from there, I was able to see a lot of community work really in action at a level I've never seen, such as a free clinic from 9 to 5, seeing over 1,000 people in that short amount of time. So as a result of that, it made me really try to think about, even though I'm looking at a unique group of individuals, how can I really reach others? So you see these things quite a bit now, but back then, this is what was hot in the streets. So I had the supercolon. So with the supercolon, I'm pretty sure most of you have seen those. They're a little bit taller than me. You can walk through them. You can see what a colon looks like when it's healthy, once it starts to develop polyps, et cetera. So with that, I had over 24,600 individuals go through this. And I like to point out that this was held at the Minnesota State Fair. Minnesota State Fair is the second largest in the country, all about great foods that, again, increase your risk for cancer, cheese curds, fried this, fried that, everything on a stick. But at the same time, I also had the opportunity to recruit over 300 African-American men to complete a survey on iPads, hence the title of the study, I Prevent, I Treat, I Beat. So with this piece is where I really focused on trying to make sure that my marketing materials were culturally specific for African-American males. I really made sure that the language was simple. You can see that the study was held on both of the weekends for the fair. And another key component is I had over 50 staff that were from the community, my colleagues, that helped make this a success. At the same time, I also conducted a systematic review of the literature looking at the relationship between social support, racism, and masculinity on colorectal cancer screening and completion among African-American men. So plenty of research shows in terms of social support that if your significant other or someone close to you is for screening, more than likely you'll get screened. And then with these other two items, they came about as, at the time I was doing this is when a lot of black guys were getting killed by cops. And so I really felt that that was even increasing the effect in terms of issues such as Tuskegee, hearing aid lacks in terms of medical mistrust, et cetera. And with the masculinity piece, with my studies I've done ranging in samples from 150 to well over 300, this has never been significant. So I really felt that this was a critical piece. So when we looked at that systematic review, only 2 studies have been done since 2000 for racism, and only 2 studies have been done in terms of masculinity. So I saw it as a win-win in terms of me being able to have work to do for quite a long time. But in order to rise to the challenge of bringing my dreams to life, I realized there were some gaps in my training that I needed to fill. So I've done a lot of work in terms of looking at attitudes and attention and enablers and barriers in terms of things that prevent guys from getting screened from colon cancer, but I felt that I need to be at a point where I can actually start changing these behaviors. So one program that I recently completed, which is funded by NHLBI, National Heart, Lung, and Blood Institute, called RISE. Research and Implementation Science for Equity. It was a program really focused on using implementation science to actually have structured interventions that are being created. And so it was during this program I was surrounded by numerous bright individuals. They were all from very, very top schools, Harvard, Yale, et cetera. And it's with this group where I really started telling them about this idea that I've been playing with for a while in terms of trying to intervene on this masculinity piece among men. So, if you think about the barbershop, I go sometimes, bald-headed. The barbershop has a huge history in the African-American community. It's a super duper safe place. It's where everything that's hot and not is discussed. Barbers may know more about their clients than their significant others do. You'll have babies all the way up to senior citizens in there. And so I really feel that this is a super duper safe and potential place for actually intervening on that. So all the things I've discussed in terms of my training and fellowship, et cetera, I was awarded on September 17th, about 5 p.m., about $900,000 from the National Cancer Institute for a KO1 study, the title, Developing a Barbershop-Based Intervention on Masculinity Barriers to Care and colorectal cancer screening uptake or completion among African-American men using mixed methods approach. And so with this study, the main purpose is to actually to design and pilot a theory-driven, culture-specific intervention that targets this masculinity barriers to care, as well as a number of things that I've studied over the past few years. I'd like to point out that what makes this study unique is one, the 45 age piece. I've been doing that my whole career, so I will be looking at men starting at age 45. And more importantly, in terms of work that has been done in the past in barbershops and salons, my study will be unique as I will be randomizing my intervention arms at the barbershop level instead of the individual. So as we focus on this KO1, which is the training award, I'll be again filling those gaps in my learning, ranging from intervention to implementation and evaluation, mixed methods research, as well as instrument development and validation. With this K, I'll be doing it here in Utah, as well as where I came from previously, Minnesota. I'm really big on community. And so ultimately, I see myself going forward with implementing an RO1 that's done across the country. Where I have these other stars is where I have members of my team and also where I have personal ties at, such as home, Sanford, North Carolina, where I was the oldest of three, born on 3/10/83, home, a place you grew up wanting to leave and can't wait to get back to. Thank you.